Hi there, my name is Mary Corcoran and I'm delighted to contribute to and endorse the 2022 annual report for the Childhood Development Initiative, CDI. As chair of CDI's Board of Management, I am so privileged to work with a group of exceptional people who take their governance duties seriously, upholding the principles of transparency and accountability. We are deeply cognizant of our responsibility to support and challenge the executive so that they can respond effectively and efficiently to the needs of the community. Our annual planning day is always a great opportunity for engagement with the staff and to deepen our understanding of all the kind of backstage work that underpins the high quality service delivery. In 2022, we were delighted to return to this session being in person, or IRL. As well as completing a fun quiz designed by our ever-creative CEO, Marian Quinn, we had time for inspiring and energising discussions with the staff about the plans and priorities for the organisation. During 2022, we held 5 board meetings and all 5 of our board committees met on a quarterly basis to provide direction and guidance. A concerted effort was made this year also to populate our committees with volunteers, and that was really effective. We are so delighted with the calibre and professionalism that resulted from that recruitment process. I hugely admire the work developed and delivered by CDI. The organisation is a true pathbreaker in sharing our learning, to build capacity across communities and disciplines, and to improve outcomes for children, for families and communities.
Hi, my name is Celine Moran and I'm the Ante-Natal 3 Initiative Coordinator with CDI. I'm here to share the highlights and achievements from 2022 on our work to support babies, toddlers and their parents in the first 3 years. 2022 was another busy and exciting year for the Ante-Natal 3 Initiative. We focused on promoting and supporting early parent-infant relationships and their importance for social and emotional development. Another exciting development was starting to work directly with parents and babies in the community by offering baby massage classes. Interagency work is a really integral part of our project and again was a key focus for us in 2022. I continued to lead and coordinate our steering group with 8 meetings taking place, providing that space for interagency colleagues to collaborate on parent-infant relationships, referral pathways, building professional and parental capacity, and responding to all the emerging needs within the community. We also focused on implementing and embedding infant mental health in the community. I took on coordinating the Tala Infant Mental Health Network, working closely with Dr. Ciara McCarthy from the HSC Primary Care Psychology team. We grew the membership of the network from 10 to 16 members and held monthly reflective meetings, providing the opportunity to build and foster relationships with multidisciplinary professionals working directly with infants and families, focusing on ongoing professional education and development and that space to reflect on the impact of the work with infant and families. We participated in reflective supervision with the other ABC Infant Mental Health Network groups, providing that opportunity for peer support linkages and learning from our ABC colleagues. The Ante-Natal 3 Initiative also actively participated in several interagency groups. I represent CDI on the SIPC Saved and Protected from Harm subgroup, which really focuses on the impact of domestic abuse, poor relationships within families and the importance of trauma-informed approaches. I'm also a member of the Kilnarden Parents Working Group, which responds to specific needs in that community, working closely with TUSLA colleagues from the South Dublin Partnership and some of the other drug projects in the area. In terms of achievements and outcomes, we secured funding for infant mental health and relation training programmes, resulting in 16 additional professionals completing circular security training, 14 more professionals attending the newborn observation training, 16 professionals from a range of disciplines completing the Solihull Foundation training, which I co-facilitated with one of our colleagues from Barnardo's. 8 additional professionals were also trained to deliver infant massage. Being Dad, our research looking at the lived experience of dads living in Tala was successfully accepted for presentation at the 18th World Congress for Infant Mental Health, which will be held in Dublin in July 2023. ATTI was successful in bringing key local, national and international speakers to present and share their knowledge and expertise with professionals, leading to improved outcomes for babies, children and families. Keynote speakers included Dr. Amanda Jones, consultant perinatal psychotherapist with the NHS, leading the largest infant mental health service in the UK. Catherine Maguire, senior clinical psychologist, infant mental health specialist based in Childhood Matters in Cork. Dr. Ciara McCarthy and Dr. Hester O'Connor, both senior clinical psychologists with the HSC primary care psychology team in Tala, and Robin Balburney, infant mental health specialist and former consultative child and adolescent psychotherapist in CAMHS in the UK. We look forward to continuing our work in 2023, working closely across agencies and professions, endeavouring to improve relationships between babies and their parents, leading to better outcomes for the whole family.
My name is Elaine Fagan and I am the Powerful Parenting Coordinator for CDI. Powerful Parenting is the name of our overall model of supporting parents with young children. 2022 was another exciting and busy year for our Powerful Parenting. Our parent care facilitators, who work directly with parents of young children, supported parents in the 7 early learning and care services where they are based, but they also cast their net way beyond, offering universal supports to parents in the wider Tala community. Some of our key highlights include over 300 parents were supported by our parent care facilitators, our PCFs. Our PCFs conducted 139 home visits in the community and offered a variety of supports, including, but not limited to, help with referrals, enhancing the home learning environment, delivering one-to-one parent education programmes, and offering practical support. Our parent education programmes continued to be well attended. 34 parents completed Parents Plus in the Early Years programme, 71 parents completed infant massage, and 16 parents completed training in basic paediatric first aid. Our PCFs hosted 64 coffee mornings and conducted 334 one-to-one meetings with parents, offering targeted support based on their individual needs. PCFs made over 150 child referrals and over 200 parent referrals to external services. PCFs also noticed a significant increase in the amount of time spent signposting parents to external services. Continuous professional development, CPD, remained high on the agenda, and PCFs received training in the PEEP Learning Together programme, Circle of Security, Parents Plus, and infant massage. 2022 was a year of change in terms of staffing, as we said a very fond farewell to 3 of our PCFs. We also warmly welcomed 2 new PCFs on board, and were so delighted to welcome one of our PCFs back from maternity leave. We were very excited to begin a collaboration with Startbright Greenhills, whose PCF is bringing CDI's parental supports to a new cohort of children and families in an area of Tala that has not previously received Powerful Parenting. We recruited for a new Powerful Parenting support officer who joins the team in 2023 to support with the coordination of CDI's parental supports. Interagency work and collaboration remained a key focus for Powerful Parenting throughout 2022. I represent CDI as a parent support champion, and I sit on various working groups including the Local Parenting Forum and TUSLA's National Parenting Working Group. In addition to this, each PCF engaged in at least 2 to 3 interagency meetings, such as MEHO meetings, case management, access and inclusion model support meetings, to name a few. CDI continued to support the role of the PCF with the provision of 7 PCF Communities of Practice, or COPs, 3 Early Learning and Care Managers COPs, 2 PCF Planning Mornings, and 2 PCF team events focusing on self-care and well-being. 12 service provider meetings were also completed in partnership with the ChitChat programme, with an emphasis on quality assurance and monitoring fidelity. We trained 33 early learning and care practitioners and managers from across the country in our 6-module online Parental Engagement and Relationships, or PAIR, training, and trained 1 PCF in facilitating the programme to enable us to deliver PAIR to a wider audience going forward. As we reflect on all of the achievements from 2022, we look forward to 2023 and anticipate another rewarding and exciting year for Powerful Parenting.
I'm going to tell you about ChitChat, our speech and language therapy service, on behalf of Michelle Quinn, who was our wonderful senior speech and language therapist, but who can't be here to do the filming. So ChitChat continued to thrive and development throughout 2022. Some of our key highlights in the year include delivering ChitChat programs in 3 Band 1 primary schools, 1 early start, and 6 community early learning and care settings in Dublin 24. 77 children were supported at the specialist level with speech and language therapy assessments and therapeutic interventions. The ChitChat staff received training in both early Talk Boost and Talk Boost Key Stage 1 programs. Talk Boost is an evidence-based program designed to support children who are presenting with delayed language development. We began the rollout of early Talk Boost and Talk Boost Key Stage 1 in autumn of 2022, training 19 primary school teachers and beginning the delivery of the program in 2 primary schools. All of that was supported by a CIPSI grant, that's the Children and Young People Services Committee, who gave us the money to deliver early Talk Boost in Dublin 24. With regard to early Talk Boost, we had 7 early learning and care centres and 1 early start engaged with the programme, in a total of 41 early learning and care staff trained. In total, we reached 167 children through Talk Boost in late 2022. In addition to all of that, we held 5 parent coffee mornings and had 36 parents attend those. We had 12 service provider meetings in partnership with our powerful parenting coordinator. We delivered Toddler Talk, which is our online parent training, to 83 parents and carers in Dublin 24. Staff turnover was a challenge for us in 2022, with 2 staff grade SLTs moving on from ChitChat. Interagency work and collaboration remained a key focus for us in ChitChat throughout the year. We launched the Talk to Your Baby Cube, which is an interagency project with our HSE speech and language therapy colleagues, and that's aimed at promoting the importance of talking to your baby. Michelle's a member of the My Place to Play working group, which is led by the Early Learning Initiative, another of the ABC areas in the Dublin's northeast inner city. That working group consists of speech and language therapists from all of the ABC areas, and they work to develop the resources and tip sheets for the delivery of the My Place to Play. Michelle delivered briefing sessions online to 110 participants from all over the country. Michelle also completed the Infant Mental Health Masterclass during the year, and now she's a member of our local Infant Mental Health Network. Our speech and language therapists continue to attend HSE speech and language therapy meetings, education sessions, and team building, and clinical supervision for our staff is provided by the local HSE speech and language therapy manager. CDI supported a student from DCU during the year on a joint placement between ourselves and Bernardo's. We supported the Blue Skies ABC in Clondalkin by sharing and facilitating the Toddler Talk series of parent trainings, and we had 10 parents from Dublin 22 attend those. Michelle provides clinical supervision for the Preparing for Life ABC Senior SLT, and she also attends the QUIT, or the Quality Implementation Training ABC Learning Community. During the year, we completed the ABC oral language paper that's been finalised and printed, and that's available. And we also developed our online summer course, which is called Supporting Speech and Language in the Primary Classroom and Beyond. And that summer course was delivered to 36 primary school teachers from all over the country. We really look forward to another action-packed year in 2023.
My name is Clare Bohan, and I took up post as CDI's Literacy Coordinator in August 2022. I have a really exciting job managing CDI's 4 literacy interventions, which offer support to children from birth to 8 years of age. In 2022, Dolly Parton's Imagination Library was a continued success in Dublin 24, with over 59,000 books delivered to almost 5,000 children monthly. Over 1,200 children registered for the scheme in 2022. We passed the milestone of 200,000 books delivered through the programme in October 2022, and we celebrated this with 2 events. The first, Being With, the Essence of Emotional Regulation, was an educational event for professionals. Dr. Marian, Executive Director of the Dollywood Foundation UK, visited and spoke at the event, alongside Dr. Ciara McCarthy and Dr. Hester O'Connor from the HSE and Dr. Sinead McNally from DCU. The event was well attended by professionals from a range of backgrounds. We also hosted a family event in conjunction with the County Library, Tala, to celebrate our 200,000 books milestone with families. Children and families enjoyed a puppet show, library bingo, a story and illustration workshop, and lots more on a fun-filled day. In 2022, we surveyed over 600 parents and caregivers of children registered for the Imagination Library. They told us about several ways in which they felt the Imagination Library impacted them and their child, including the opportunity to spend more time with their child, enhancement of their child's enjoyment of reading, and improvements to their child's literacy development. Over 80% of parents and caregivers reported that their children enjoyed reading, 95% stated that they themselves enjoyed reading to their children, and 90% agreed that they have an important role in their children's reading and writing development. We were generously supported to deliver the Imagination Library in 2022 by An Post, Amazon Web Services and the Stocker Foundation. We continue to reach 73 to 75% of the population of under 5-year-olds in Dublin 24 and hope to build on this in 2023 by continuing to develop mechanisms to monitor participation and increase engagement of hard-to-reach and vulnerable groups. Doodle Den is our literacy programme for children in senior infants, which has been benefiting children in Dublin 24 and beyond for over 15 years. Children attend Doodle Den 3 times per week for 90-minute sessions across the whole academic year. This equates to 144 hours of additional literacy support. Sessions consist of lessons on phonics, writing and sight vocabulary, while also incorporating fun elements like drama, art and music. In the academic year ending in 2022, we saw the programme implemented in 11 schools across Dublin 24 and Dublin city centre, reaching almost 200 children. Children's phonics skills, sight vocabulary, social skills and writing skills improved on completing Doodle Den. 14 new Doodle Den facilitators received training in September 2022. In the current academic year, there are 11 Doodle Den groups in Dublin 24, 11 groups in Dublin city centre and 1 Doodle Den group in Limerick City. That's almost 350 children receiving an intensive evidenced intervention. In July 2022, CDI presented at the European Conference on Literacy hosted in Dublin. We outlined data on the impact of the COVID-19 pandemic on early childhood literacy skills for children in Doodle Den. The findings outlined that children still benefited from Doodle Den in terms of improved phonics and sight vocabulary scores, despite significant school closures amidst the pandemic. We continue to conduct high-quality research on Doodle Den, with a social return on investment study underway and due to finish in 2023. We strive to continue to implement Doodle Den with high quality in 2023 by working closely with our partners in schools and school completion programmes. Doodle Families is an 8-week family literacy programme delivered to children in first class and their parents. Parents attend a 1-hour session once per week, as do children. The programme is manualised and focuses on the promotion of family literacy activities. In 2022, Doodle Families was delivered in 6 schools to 11 groups in Dublin 24. The programme was also expanded to 2 new areas, Drogheda and Clonshaugh, with the support of funding from Amazon Web Services. 3 new partner schools in these areas ran 4 Doodle Families groups. Feedback suggests that these schools will continue to implement the programme and that it was a very positive experience for families and staff. 36 Doodle Den and Doodle Families facilitators attended CPD training with Dr. Jennifer O'Sullivan, an expert in literacy from Marino Institute of Education. We presented at the NALA Family Literacy Conference in November 2022, focusing on the benefits of family literacy interventions like Doodle Families. In 2023, we aim to continue to support the delivery of Doodle Families in 6 schools in Dublin 24, while maintaining links with schools in other areas such as Drogheda and Clonshaugh. We are also supporting the ABC in Cork, Let's Grow Together, to establish Doodle Families there. Doodle STEAM is CDI's newest literacy programme. It aims to support parents' engagement in science, technology, engineering, arts, and mathematics with their children at home. The programme was developed in 2022 by researchers at the Institute of Education in DCU and was piloted across 3 Tallaght schools. Doodle STEAM runs for 8 weeks and is facilitated by the Homeschool Community Liaison Coordinator, or HSCL. The HSCL delivers 8 one-hour sessions with parents of children aged 6 to 8 years. Each session focuses on a different STEAM topic. The sessions are practical, hands-on and fun, and provide parents with the skills to engage with STEAM activities with their child at home. The pilot of Doodle STEAM took place in 3 schools from September to December, with 33 parents taking part. Anonymous feedback was collected from the HSCLs and parents at the end of the programme. After the programme, all parents agreed that they felt confident doing and talking about STEAM activities with their child, and that STEAM subjects are very important for their child to learn. The programme facilitators responded positively to Doodle STEAM too, citing enjoyment of the programme in their feedback and stating that they felt parents really benefited. Feedback from the parents and facilitators has been central to improving the programme for further iterations in 2023. Doodle STEAM will undergo an independent evaluation, and we aim to see it sustained and expanded in primary schools.
My name is George Best and I am CDI's Restorative Practices Programme Coordinator. I'm delighted to tell you about some of the highlights from our 2022 RP training programme. 2022 was a busy year for our Restorative Practices programme, as exemplified by a sharp increase in the number of RP training courses we delivered throughout the year. Overall, a total of 930 people from across the country undertook the Restorative Practices training, more than 100% increase in the numbers trained as compared to 2021. We delivered 88 RP training courses in schools, community, family and youth services right across the country. 35 people qualified as CDI Restorative Practices trainers. Our national RP trainers panel expanded to include 106 people located in 18 counties. We also trained 12 new RP champions who will go on to deliver our Training of RP Trainers course. We continue to provide ongoing communities of practice for RP trainers with an average attendance of 14 trainers per COP. 2 CPD events were held for trainers during the year with an average of 15 people attending. CDI's RP podcast Season 1 reached over 10,000 listens.
My name is Aoife Flynn, and in September 2022, I was lucky enough to begin working in CDI as coordinator on NOVA, CDI's youth mental health project for school engagement and wellbeing. NOVA is a 3-year-long pilot and was created as a response to the ever-growing and wildly unmet mental health needs of young people in Tallaght, as reported in the 2019 In-Betweeners study. Some of the exciting progress made since the project started. 9 pilot schools were identified and brought on board to participate. This includes both DESH and non-DESH primary and post-primary schools, with 14,200 students in total across them all. Key stakeholders were identified and an advisory group was set up with members from all relevant agencies, including Tusla Education Support Service, Fagan, HSE Mental Health Services, CIPSI, Jigsaw, CAMS and NEPS, as well as primary and post-primary school representatives. 2 information events were held in CDI for the schools and services involved, creating an opportunity for networking and feedback, and marking the beginning of what endeavours to be ongoing, strong, collaborative relationships across the different agencies. In addition to the overall advisory group, 4 working groups were established to support and oversee the development and direction of the project's work packages. These working groups are made up of representatives from each of the different services and stakeholders of the project. Since being established, the advisory groups meet bi-monthly and each of the working groups meet every 4 to 6 weeks. The working groups are responsible for guiding the individual elements of the project, including the School Avoidance Toolkit, the class-based CBT programme, the metal model and the project's reflective practice element. The School Avoidance Toolkit working group, which includes stakeholders from the education and health services, are working on the design of an online toolkit, an accompanying training package for schools and parents. This piece of work also includes collaboration with As I Am, Ireland's national autism charity, to ensure our content is neurodiverse and accessible. Since beginning, I've completed training in Friends, a school-based positive mental health programme, METAL, NVR, Nonviolent Restraint, Restorative Practices, and the Lundy Model. Using the Lundy Model approach, a youth advisory group made up of secondary school students was also established to ensure that the voice of the child is captured and that they are directly involved in decision-making within and throughout the project. The youth advisory group are responsible for naming the project and are currently involved in the project's logo design. An independent researcher from Trinity College Dublin has been commissioned to develop an action research evaluation of the mental intervention element of the project. It's been a busy and exciting few months, and we're looking forward to more of the same in the year ahead.
So now you've met all of the CDI team, and I hope you're feeling inspired and interested and enthusiastic about the work, because that's how we all are about the work we do in Tala and beyond. Hopefully, having listened to all of the staff talking about the work we did last year and hearing the enthusiasm, you'll have picked up on some recurring themes in how we do our work. So we always work in partnership, and we're really grateful to the schools, the youth services, the local authority, all the local voluntary organisations that we work with, because literally we couldn't do this work without all of your help. You'll also have heard about how we collect evidence so that we ensure that everything we do has the best opportunity to improve outcomes for children. And we're also really committed to sharing that evidence so that we can influence and support others in delivering really good, effective services for children and families. We are committed to the work in the community in Tala. Tala is our home, it's where we've come from, but we're also increasingly working at a regional and national level, and that's very exciting for all of us. And again, we're developing partnerships and collaborations with a lot of different organisations around the country, and that's only set to grow in the coming years. And finally, you will have heard from the other staff that everything we do is about being really clear on the relationships we have, bringing in stakeholders who can work with us effectively, working in partnership. And I really hope that you've understood how all of us work really, really hard, but we also believe it's important to have fun while we're doing that. And so there's great connectivity within CDI and across the different aspects of our work, as well as externally with all of our full range of stakeholders and funders. And so I'm really glad you've listened to us, and I hope that we continue to work with you and that we have offered you some inspiration and insight into the amazing work that the Childhood Development Initiative has been delivering and will continue to do so in Tala and beyond.